Hey, welcome back to Paramedic Project. Thanks for joining us once again. Today, second episode on patients suffering thermal burn injuries. Now, in my experience, one of the big things that a lot of paramedics do wrong when they're treating and assessing these patients is that they don't actually assess the percentage of surface area burnt very accurately. And there are a couple of big reasons for this. First of all, I think a lot of paramedics use rule of nines when they're actually assessing the percentage surface area burned. And realistically, often the burns that we actually see patients suffering don't really follow that pattern of nines. So it becomes a little bit confusing, in which case I like to just go back to that old size of one or surface area of one hand, and one of the patient's hands equals about 1%. So often we'll get just a stripe of burn somewhere, or a stripe of burn on a flank, or down a medial aspect of a leg, or all different types of patterns that really fall outside the rule of nines, in which case I just use that one hand equals 1% technique. So that's the first thing. Second thing I think it's really important to consider is that we're not considering erythema, that red and painful area around the actual burn, when we talk about percent surface area burn. We're talking about partial thickness burns and full thickness burns. So that's what we want to calculate the percentage of. That's what we want to communicate to the burns unit, to the hospital before our arrival. Finally, one final thing to consider when we are treating people or patients with full thickness burns and partial thickness burns in particular is that, yes, we are seeing that surface area on the outside of the patient's body, but in reality, those partial thickness and full thickness burns can often extend far deep. Particularly full thickness burns can extend deeper into tissue, which means that they're going to have far further reaching systemic effects of this burn that we need to take into account with our care. So that's my big tip on percentage of surface area burn. And in reality, in practice for me, what I always like to do when I'm calculating this percentage is that, yes, calculate it initially when we're doing our patient assessment, but then before I phone the receiving facility, I always like to go back and double check my percentage just to make sure it's an accurate percentage that I'm communicating in my clinical handover. It's been Paramedic Project. Thanks for joining us. Find us on social media. We'll see you next time.